Disaster management. Introduction. Disasters are as old as mankind. The first description of disaster and its management comes from the mythological Noah and his ark. Similar flood tales are widespread in Greek mythology, Puranas, many stories, and many cultures. Definition. Disaster: any occurrence that causes damage, ecological disruption, loss of human life, deterioration of health and health services on a scale sufficient to warrant an extraordinary response from outside that affected community or area. A disaster can be defined as an occurrence either nature or man-made that causes human suffering and creates human needs where victim cannot alleviate without assistance. Hazard: any phenomenon that has the potential to cause disruption or damage to people and their environment. When hazard involves elements of risks, vulnerabilities, and capacities, they can turn into disasters. Hazards may be inevitable, but disasters can be prevented. Types of disaster: major natural disasters, flood, cyclone, drought, earthquake; minor natural disasters, cold wave, heat waves, mudslides, storm; major man-made disasters, setting of fires, deforestation, chemical pollution, wars; minor man-made disasters, road or train accidents, riots, food poisoning, industrial disaster, environmental pollution. Disaster management: the body of policy and administrative decisions and operational activities that pertain to various stages of disaster at all levels, encompasses all aspects of planning for and responding to disasters, including both pre and post disaster activities. Aims: an applied science which seeks systemic observation and analysis of disaster to improve measure relating to prevention, emergency response, recovery, and mitigation. A continuous and integrated process of planning, organizing, coordinating, and implementing measures which are necessary for prevention of danger or threat by any disaster, reduction of risk of any disaster or its severity or consequences, preparedness to deal with any disaster. Prompt response to any threatening disaster situation, assessing the severity or magnitude of effects by any disaster, evacuation, rescue and relief, rehabilitation and reconstruction. Integrated disaster management, preparedness, activities prior to disaster, preparedness plans, emergency exercises, training, warning systems. Response, activities during a disaster, public warning systems, emergency operations, search and rescue. Recovery, activities following a disaster, temporary housing, claims processing, grants, medical care. Mitigation, activities that reduce effects of disaster, building codes and zoning, vulnerability analysis, public education. Disaster management continuum, proactive strategy, holistic and continuous process, fundamental or of prompt and effective response. Prevention, mitigation, preparedness, reconstruction, rehabilitation. Phases of disaster management: disaster preparedness, disaster impact, disaster response, disaster recovery, disaster mitigation. Disaster preparedness. Disaster preparedness is ongoing multi-sectorial activity, integral part of the national system responsible for developing plans and programs for disaster management, prevention, mitigation, response, rehabilitation, and reconstruction. Evaluation of the risk, adopt standards and regulations, organize communication and response mechanism, ensure all resources ready and easily mobilized, develop public education programs, coordinate information with news media, disaster stimulation exercises. Medical preparedness, developing and capacity building of medical team for trauma and psychosocial care, mass casualty management and triage, determine casualty handling capacity of all hospitals, formulate appropriate treatment procedures, involvement of private hospitals, identify structural integrity and approach routes. Disaster response, immediate reaction to disaster as the disaster is anticipated or soon after it begins in order to assess the needs, reduce the suffering, limit the spread and consequences of the disaster, open up the way to rehabilitation. By mass evacuation, search and rescue, emergency medical services, securing food and water, maintenance of law and order. Disaster impact and response, search, rescue and first aid, field care, triage, tagging, identification of death. Medical and public response, food safety and water safety, animal control, carcasses can foul water, zoonotic diseases, vector control, mosquito and rodents. Communicable disease control, measles, diarrheal diseases, ARI and malaria, breakdown in environmental safeguards, crowding of persons in camps, malnutrition, waste management, temporary latrines, chemical toileting, sewage disposal damage. Management of hazardous agent exposure, also infectious agents if hospital or scientific laboratories are damaged. Consequences of disaster, health, physical, injuries, disabilities, death, psychological, cognitive, behavioral, social, structural damage to variable extent, ecological, change in ecosystem, economical, financial losses. Diseases after man-made disasters will depend upon particular exposure type. Symptoms and diseases differ widely. Spectrum may range from simple non-fatal injuries to chromosomal defects. Again, technology that is capable of producing mass destruction weapons and developments in biotechnology leading to invention of deadly biotic organisms is of ever-growing concern for world. Rescue workers in disaster, secondary victims of a disaster, more emotional trauma if involved in a failed rescue attempts, especially if children are involved. Inexperienced body handlers become more sensitive. 19 August is observed as World Humanitarian Day in honor of aid workers who lost their lives. Disaster recovery, repatriation. After the emergency is over, displaced people return to their place of origin. Rehabilitation, restoration of basic social functions, providing temporary shelters, stress debriefing for responders and victims, economic rehabilitation, psychosocial rehabilitation, scientific damage assessment. Elements of recovery, community recovery, including psychological, infrastructure recovery, services and lifelines, economy recovery, financial, political, environment recovery. Disaster mitigation, permanent education of a risk of disaster to limit impact on human suffering and economic assets. Primary mitigation, reducing hazard and vulnerability. Secondary mitigation, reducing effects of hazard. Components, reducing hazard, protection against threat by removing the cause of threat, reducing vulnerability, reducing the effect of threat. Natural hazards are inevitable, reduce vulnerability. Components of disaster mitigation, hazard identification and mapping, assessment, estimating probability of a damaging phenomenon of given magnitude in a given area, considerations, history, probability of various intensities, maximum threat, possible secondary hazards. Vulnerability analysis, a process which results in an understanding of the types and levels of exposure of persons, property, and the environment to the effects of identified hazards at a particular time. Prevention, activities taken to prevent a natural phenomenon or potential hazard from having harmful effects on either people or economic assets. Risk analysis, determining nature and scale of losses which can be anticipated in a particular area, involves analysis of probability of a hazard of a particular magnitude, elements susceptible to potential loss or damage, nature of vulnerability, specified future time period. Role of physiotherapy. Physical therapists can contribute to a disaster management before, during, and after a disaster. WCPT is committed for promoting the engagement of physical therapists when disasters strike, to provide members to organizations and individuals with information to guide, prepare, and support them. It aims to ensure that physical therapists are engaged at an organizational level so that they can provide services to affected individuals and communities, save lives, and improve outcomes for survivors. Disaster preparedness starts from personal, family, community, and the country level. Proper injury management and rehabilitation is one of the most important priority now, and this is not possible without the physiotherapist. Functional management should always be coupled with psychosocial first aid. In disaster recovery, linking the acute response to ongoing rehabilitation and support.